Hi everyone, it's Kristi from OrthoCore Physical Therapy. I just wanted to check in with everybody and see how everyone's doing. I miss seeing my patients greatly. Just wanted to let you know about a great telehealth appointment that I had with a pregnant patient who was about 32 weeks, and she's been having excruciating back pain. Finally reached out and emailed me and asked for some advice, and I told her about the wonderful telehealth services that we are fortunate to provide to our patients. So I was able to just help her through, let her just talk about what her symptoms were, show her some stretches that she could do, also teach her some things that she could have her husband help, since I couldn't be the hands-on, a little bit of like a hip squeeze. So, and talk about, labor and delivery and offer different suggestions to help with that as well, to make that more comfortable and ease for her, and if she was having back pain. So one of the things I just sort of wanted to share with you was, it's called the hip squeeze. So I have my nifty little pelvis here, and with the hip squeeze, what you can do is, I taught her how to have her husband just push on her hips a little bit. So by doing that, I'm just going to flip over the pelvis here. Okay, so in your hands and knees position, your husband, partner would just grab right on to your hips right here. Okay, and just give those hips a little bit of a squeeze. Now by doing that, what's going to happen is it's going to go ahead and it's going to open up this part of your pelvis. Okay, so it's going to splay these bones open here. By squeezing here, this part's going to open. So what will that do? It will allow for everything to open up more for the passage for that baby to come out, so there's less risk for tearing. It also will help with any back pain during delivery, and also I said he can do a gentle hip squeeze right now for you, and that will also take some pressure off your back. And so then I gave her a couple stretches, a couple different exercises, watched her do them, give her some cues, and she said that she felt better afterwards. So I was really happy that I could give her that relief, because otherwise she was thinking she was just going to have to go through this pain and wait until either she was able to get in for a PT session when we can reopen, or just live with it until delivery. I also wanted to throw out that there's a couple different summits going on that are free online services. I'll post the link below. I will be following them as well. It's great information even as a PT, but also as a patient or as a mom-to-be, postpartum, or even during pregnancy. One of them is somebody that I recently went in September, Lynn Schulte. Went to one of her fabulous courses where I learned a lot of these hands-on techniques that I've been using with my patients. She is doing a birth healing summit that will start in, I think, about a week. Again, I'll send the link. It's free. Some fabulous information there. How to heal your diastases recti if you have one, how to ease labor and delivery, opening up your pelvis like we just talked about. She'll dive into some more techniques, and there's just some great information out there with some great practitioners, anywhere from OBs to yoga and Pilates instructors and other really awesome physical therapists that specialize in women's health. So great information there. I also have a really good friend who is also put on a pregnancy and postpartum free summit as well, where she has had nutritionists and doulas and OBs on there, just providing like some information on nutrition, and just give you some support through this postpartum time, because I know it's really difficult with everything going on, and maybe you had a traumatic delivery recently, just with not being able to have the support systems there, with the limitations of who you could bring into the hospital, and everything else. So some other great information. This is my daughter Taylor. She just wanted to come and say hi. Say hi.
Who is this?
I'm talking to my patients.
Then I can see her.
So if you are in any pain at all, or just have questions about pregnancy or delivery, not sure about what this ache or pain is, or just not feeling like yourself after giving birth, please reach out to me. I'd love to even just, chit-chat over email or even provide a telehealth service. I think it will be really beneficial to you and really helpful. So stay healthy and safe, everyone, and take care.